Are we on yet?
Yep.
Hey, I want to put this thing on. I have no place to put that on. Here on top. No background music, nothing?
No.
Why are we so quiet?
Because they can hear you.
That's okay.
There's 2 people watching.
Who's watching?
I can't tell. I think Diane.
And?
I don't know. I'm gonna share on e-bike.
Okay. Okay, so this is my very first Facebook Live. So let's see what we're gonna do together. Now, I talk to a lot of my patients all the time about anxiety, depressions, and how to deal with them. I think it's just very much a part of life for all of us, and I think it's really important that all of us have some sort of ability, a plan in order to deal with them effectively. But before we actually jump into that, I think it's best to hear the story, true story, on a patient that I saw today. She's doing really well with some chronic medical conditions, but she's actually super sad today. And I know her for a long time, and she usually bubbly kind of person coming in, has very positive attitude. She said that she hadn't been in touch with her mom for a long time because she kept her mom at a distance. Since she was growing up, her mom wasn't very good in taking care of her. And she's been doing well, kind of escaped from that cycle of not thriving in life and society. Then she actually let her mom back into her life. And now she just feels terrible all the time. She feels guilty, she feels depressed, she feels anxious, all the typical symptoms that she used to feel when she was little. So they asked her why and what happened. And of course, you know, all the same story and issues and problems she dealt with when she was little. We're talking about like 4 or 5 years old and a little bit older as well. One of the advice I gave her is that it's like someone knocking in your front door, including her mom, and then she gave her a poison, a cup of poison, and say, well, guess what, honey, why don't you drink this? Now, if you actually say, yes, mom, and drink up the poison, of course you're going to feel terrible, you're going to feel sick. And that's exactly what happened to her. So just because her mom showed up at her front door and actually gave her the poison does not mean that she should drink it up. She can still be courteous, she could be cordial, she could be loving, but she does not have to drink the poison. And I think that's really the important part about how to deal with stress and anxiety in life. many of those people that we love are the ones that usually cause a lot more heartache and everything else is with that. Just borrow the phrase, one of the simple thing, I think the approach to deal with anxiety, depression, I think you want to keep it really simple. Sometimes you go to different counselor and do different issues and problem. You get all of these advice, but there are too many of them and you can't remember. Well, if you don't remember the advice, how are you going to implement them? So the advice I have for a lot of folks is just let it go. Just like when you watch the movie Frozen, just let it go, right? Because when you let it go, you're not holding on to it. And so when you're not holding on to it, it's not going to be a big problem. Going back to the mom and the daughter or son's issue, the situation is all of us are pre-programmed to love our parents no matter what. And the same thing for the parents to love the children no matter what. And so regardless of what happened, whether you have good time or bad time, it will be the case. So instead of running away from it or take some extra supplement or do some extra mindfulness meditation, all of that's going to help, but none of that is going to solve the problem. The problem is going to be solved only if you have a way, a game plan, a technique to deal with that. And again, don't drink the poison. I think that is the most important thing. That would be extremely helpful. Now, as you're kind of joining in, feel free to type in your questions so then that way that we can answer all of those as much as possible for you. And any other topic that you might have, we can do something similar in the future. And then we go from there. Second scenario we have today, again, same thing in clinic today. I have a patient, she's about 36 weeks pregnant and she's like super anxious all the time. She's just like so worried about everything, and this is second baby, so it's not the first go around. And the question is, how can I help her? Then the first question I ask her, just like many other ways I deal with other kind of medical problem, is ask why. Why is she anxious? Was it something that happened to her? Up to 30-40% of us have been mentally, physically, or sexually abused at some point in our lives, and that's actually resulted in a situation where you have terrible anxiety, depression, PTSD, and all of that. Sure enough, she has one of those scenarios that happened to her, and so then she became anxious throughout her life. And then with that, she also got depressed as well. So the question, how can I help this person? And the beauty is that when you help this individual to cope with anxiety, not only is it going to be helpful for her, but it's going to be helpful for her baby and also those around her. Because why she's a lot of times, some of these folks, even like someone they come in, they say, well, I never had any issues and problem in my life, and I'm still anxious. I'm always anxious. Well, sometimes the anxiety actually come when you actually within your mom's womb. If your mom is anxious and running around and have that kind of feeling, then the stress hormone is increased. And guess what? As a baby, you're already exposed to all of that extra stress hormone. Now, once you're actually born, even though you don't remember anything when you're growing up as a little baby, you're already exposed to the similar environments as well. So what you need to do is, what do I do to deal with these kind of situations? So anxiety is the funny thing is that over time, sometimes you kind of second guess yourself. You're not sure. You kind of take it in. So the first thing first is that you need to gain a little bit of confidence, because in the absence of confidence, then how are you going to overcome the scenario? So the two advice I gave her for specifically for this is that she needs to do what I call the mirror exercise and writing exercise. So every morning, I would like her to look herself in the mirror, as imperfect as she is, and good morning to yourself. And this is what I do every single morning. So good morning to myself in the mirror. And just laugh and smile at yourself, because you need to embrace that person right in front of you. That person is you, and you need to be the one to embrace and love that person. Because if you cannot love yourself, who else is going to do that? So you need to do the first step. Once you actually love yourself, then guess what? You're going to be able to attract more of the similar person also love themselves and have a sense of confidence to be a part of your life. And then all of a sudden life become a lot better. So the mirror exercise is number one. Number two is I call the writing exercise, specifically for this lady, but it doesn't have to be. It could be other scenario. You could have a history of having mental, physical, sexual abuse before, or you get bullied, or any other kind of issues and problem going on with your lives. And then all of a sudden, in a moment in time, you get this overwhelming feeling, sort of like, you know, you hear about that from PTSD, that it feels like it just happened yesterday. What do? Well, when that emotion, the overwhelming, boil over the top emotion comes your way, get a piece of paper out and write down whatever the deep, dark feelings that you have or emotion that comes to your mind. And I'm not talking about just the regular stuff that you write in your journal. I'm talking about the deep, dark secret that you want no one to know, not even your spouse or your closest friend, because it might be immoral, illogical, and illegal even. So if you want to kill somebody, you want to curse at anybody, feel free to write them all down. After you're done, tear it up, burn it up, and flush it down the toilet. That way no one needs to read them, but you let it out. The point is you let out those emotions. The analogy I use is like a pressure cooker, and you know, when the pressure cooker is kind of simmering, it's kind of bubbling under, but when it's starting to kind of shaking a little bit, if you don't let out those puff of hot air and steam, the next thing you know, you have an internal explosion. Well, that's terrible. That's what anxiety, depression, and PTSD and all of those psychiatric diagnoses come in. Now, if you actually have to have such a high pressure and the whole lid actually came off, well, that's what rage are, and that's why people start to, you know, do all of these mass killing and all of those terrible things that happen that you hear about. So to prevent that, you need to let out those puff of hot steam and air at the right place at the right time. So you do a writing exercise. And I think that's one of the reasons why sometimes people go to many months or years of psychotherapy and they learn all these different techniques, but it seems to be really, they're struggling. They're not actually improving a whole lot. And one of the reasons why is that sometimes when you go to that appointment, you actually feel fine. You might be happy at that time. You don't have a lot of emotion. You don't have any issues and problem. And so then all of a sudden it's hard to let out those hot steam when you weren't even having any major issue and problem at that point. And then sometimes you're actually sitting around talking to your counselor, and then eventually you get to the level where things start bubbling up, but then guess what? Time might be over. And then you haven't been able to take the full advantage of that counseling session. And I think that sometimes is an issue. But more importantly, I think by doing these two exercises, you are in control of your life. You no longer rely on a doctor, medication, a counselor, friends and family to help you. You are in control of better your life. Now it's going to take some time, but then slowly you're going to be able to start that healing process, and you're going to be in control for your emotion. And I think that's extremely important. So those are two real life scenarios that happen. I deal with this all the time, and in very different kind of variety and fashions. But I think all of us can use some of that example and maybe apply some of that to ourselves. Now all of us are different, so sometimes you might find one technique works better than another, or sometimes it is so hard it's impossible. Like going back to the very first lady, she's like, well, but you know, when I talk to my mom, it gets overwhelming. I can't help myself. I just get out of control. I start to get rage and everything else. So I told her that, well, then maybe you do is write on a piece of paper. Tell yourself, let it go. Or if you can't even do that, then tell your daughter, and she got full-grown daughter, tell your daughter, just come out and give her hugs at that point in time and whisper in her ear, Mom, let it go. And then when those routines happen, all of a sudden, you have a mechanism in place to not drinking the poison, not making things worse, not having more anxiety and depression. So I'm going to go to some of the questions that some of you are posing for me. So I guess first question is, when you are feeling overwhelmed or stressed, does it affect your sleep? What are some tips to help you with the sleep issue? The answer is absolutely. You don't need me to tell you that. The best doctor in the house is actually you yourself. You know your body really well. And most of us will know, yeah, I can't sleep because I get stressed out. The first question you always ask is, why is this happening? From a physiologic standpoint, well, you get a lot of stress hormone. Cortisol, and adrenaline is going to get you up and running. And so when that happens, you get all hyped up. There's a number of bad things that happen to you. Of course, when you do that, you increase the amount of carbohydrate or cortisol level. And you know, knowing me, for many of you, taking a lot of carbohydrate can be a problem because it actually makes things even worse for other scenario. But in general, your stress hormone goes up, your adrenaline goes up, so you get super hyper. It's like running out on the block and then trying to go to sleep at the same time. It's almost impossible. You need to calm yourself down. So the way to kind of calm yourself down is to do something that will burn up those extra amount of energy or the extra amount of stress hormone that was released to you. So do some sort of heavy duty cardiovascular exercise would be helpful. Now it might happen in the middle of the night and you can't just run on the treadmill or run out. I would recommend just do some of the simple exercise I talked to you about before. For example, you can just do 10 push-up, 20 push-up. It doesn't really matter how many push-up, it's how many minutes of push-up. So if you can only do one push-up a minute, well then just do 1 minute push-up, but one push-up. If you can do 20, great, do 20 in that 1 minute. Planking is extremely helpful because then again that will help to exert the extra energy. Pull-up would be helpful. So any one of those kind of exercise that you can do in your own room, nice and easy, but it's going to help to let go of all of that. The thing you don't want to do is don't make things worse, because for example, you start to get some drink some alcoholic beverages, then all of a sudden the alcohol is going to increase the amount of sugar in your liver even more, and so you might be calming down a little bit from the alcohol effects, but the sugar actually is even higher, and that becomes an issue later on in your late night sleep. For example, you might wake up in 2-3 o'clock in the morning. Now, if you said, well, I did all of that already, and I'm still all wired up, or I went to sleep and then I woke up at 2-3 o'clock in the morning. My advice is, when you woke up at 3 o'clock in the morning, have you ever asked yourself the question, why I wake up at 3 o'clock in the morning? Well, because 2-3 o'clock in the morning, that's when your mind is closest to the collective us universe. And those of you who actually believe in God, that's when you are closest to God and be able to listen in and receive the message. So instead of being frustrated and say, oh my God, I can't go to sleep, I need to go to sleep because I have to go to work early tomorrow, then instead of doing that, ask yourself the question. Any question that you need answer but you don't know. So say, wow, if I need answer for whatever, and ask that question at that point in time, the beauty is, chances are, answer is going to come right to you front and center. The trick is, when you hear that good advice that just come to you out of nowhere at 3 o'clock in the morning when you woke up, instead of, oh, great idea, I'll remember in the morning. Well, guess what? You're going to forget it in the morning, so write it down, pick a little note for yourself or something like that. Whatever the great idea usually comes at about 3 o'clock in the morning, because your mind is completely wide open and you are more connected to the rest of the world and the universe, so therefore great ideas and answers come to you. So take advantage of that. And after a few times, you're going to feel so amazingly peaceful, and then you can go to sleep again. And I think that's really the important thing. Next question. How can you support families and friends that are going through a rough season? Well, I think the important thing is sometimes a lot of us, our heart just basically aches because we love someone. when we love someone and we see that they have so much stress, anxiety, depression, PTSD, we have this urge to do something about it. But guess what the answer is? It has to be at the right place at the right time. Sometimes people just are not ready. And when they're not ready, coming right at them and doing that, it's the same thing as nagging. So no point in nagging your loved one when they really don't need to be nagged and they already have other issues and problems to deal with. So then just ask them a simple question. A lot of us human beings, we just need support, emotional support. And just let people know, you know, honey, I'm there. I'm available. I'm only a phone call away. Let me know when you want to talk or when you're having any issues and problems. Let me know how I could be of help. And once people hear that, they have the level of comfort knowing that, yeah, I can rely on that person. And that person is not going to be judgmental to me. And whether it's a friend or family members or close friends, doesn't really matter. The fact that you have an unconditional support and love from that individual is going to be huge. So when people go through a difficult times in their lives and they have that, they're going to feel a lot more stable. They're not going to spin out of control as much. So if they were going to do something, quote, unquote, stupid, then they're more likely to talk to you first. And that is going to be extremely helpful. But at the same time, you need to be prepared. So don't just offer the support when you're not going to do about it. So when you get that phone call, when you get that text, when you get that crying for help, you better be ready. You better drop everything and help them. Because if you say, oh, well, you can call me anytime, and then when they text and call you and you're nowhere to be found because you're too busy with certain project or other life obligation, then that's as bad as lying to someone. So don't get into that trap. If you can do it, make sure you do. And if you don't, then let them know. Even if you promise someone and at that moment in time you cannot, that's okay. Just let them know, hey, you know, I got tied up right now. I'll call you back within 15 minutes or 20 minutes or whatever the time is. The important thing is you need to show that you care. The more that show that you care, I think is the most important thing. In all of this, I think the secret in those kind of interaction is that when people are down and out, guess what you think is front and center in their mind? Fear. They are fearful about being depressed. They are fearful about the unknown. They are fearful about past history, overwhelming emotion, uncertainty in life. So what is that support that you give, you lend to your friends and family? You lend them the sense of hope. And when you actually have hope, you can conquer all fears. But you gotta be there. You gotta help them to be hopeful. And you yourself should be hopeful as well. Because if you are not hopeful and you just kind of fake it, it's not gonna be, they're gonna see right through you. So if you're already depressed and anxious and everything else, you wouldn't be the best person to lend help and support, just because the fact that you don't want it to be equally as anxious and depressed as that other person. So there might be you need time to get some professional help, or might be to get some other family members can help, but I think that's really important. Next question. My helper here will ask me, let's see what she has any more questions right here, so then we can do that.
Okay. When we are unconsciously programmed to keep going, when we are in high-stress jobs without having a chance to process from one situation to the next, how do we let it go?
Let it go is an important concept, and it's easy said than done. Just like diet, just like exercise, just like cold shower. I forget, you know, those of you who know me, I talk about cold therapy. Well, you know, easy said than done. And so how do you do that? The best doctor in the house is you. So when you find yourself running on that, you know, it's like a hamster on the, you know, the wheel. And if you run as fast as you can and you get to nowhere and people come along and tell you, oh, let it go, meditate, you know, all these stuff. Well, that's a whole bunch of BS, because you feel like it's an impossibility for you. You can't even run fast enough. Well, maybe you should get off that wheel. It's okay to reevaluate your life scenario. It's okay to slow down a little bit. It's okay to take a break to see the situation. Just like when you're driving around in the fog, you think that everywhere is foggy. But guess what? It's not foggy everywhere. Sometimes the fog is only clumped up a certain area. So what you do is that you actually keep driving or stop, plan it out, and then maybe you can find a way to get out of it. The definition of insanity is doing the same thing and expect different results. You don't ever want to do that all the time in your life. So whenever you do that and you found yourself doing the act of insanity, then what you should do is take a break, pause, reevaluate the situation. All of that reevaluation do is going to give you a sense of clarity. And remember, we're talking about the lack of sleep, I can't go to sleep. Well, maybe ask yourself that question at 3 o'clock in the morning when you woke up, and maybe the answer is going to come to you. Now, that answer might or might not be applicable to other people. It's only applicable to you, and that's the beauty. It's going to be applicable to you, and therefore you're going to know exactly what needs to be done. Now, the trick is that sometimes those kind of answers or those kind of ideas that pop out at 3 in the morning might sound so, unusual and not conventional. What I would hope that you do, and I do this all the time, just take the leap of faith and go for it. Because there's going to be two possible outcomes. One is that was a terrible idea, didn't help me a single bit. Okay, it's going to be good training exercise. But two, wow, that was cool. I couldn't believe that I can do so much more. Well, that's good as well. So either way, it's going to be a good outcome for you. And so just go for that. And I think that get to the other discussion I had with some of my patients about faith. Because what does faith do? Faith basically gives you that courage to take that next step, to take the leap over the canyon where you think that there is absolutely no hope. But faith is going to help you to have the courage to take that next step.
For a person who suffers with standing and physical pain when they're walking and even standing in line is unbearable, she usually applies what she's learned in Qigong, like breathing and mind over matter, but it usually goes all out the door. So what should she do?
That goes back to your body. Your body is like this big old amazing machine, and if you keep putting poison in there, it's going to break at some point. So the fact that your body is aches and pain everywhere, and you have a hard time even lift your legs and move a single step or two, that just means that your body is telling you, oh my God, that's a cry for help. I'm hurting inside. So the question, the answer to that is, why is this happening? So then you ask yourself the question, what is it that I do or eat or drink or stressor in my life that actually make it worse? So even before you get better, you need to find out what makes it worse. And so once you know what makes it worse, for example, if you get stressed out all the time because you got a terrible job, well, then maybe it's a good time for you to change your job, or maybe change the way that you look at your job, or look for other alternatives. If you drink soda all the time, for example, or drink juice all the time, for example, well, then maybe it's the fact that you have too much intake of the fuel of life. Carbohydrate is a fuel of life, and so if you get too much of that, and a little inflammation you have in your body, and if you have a lot of aches and pain, fibromyalgia and all of that, pouring more fuel in that fire is going to be the wrong things to do, because you're going to have a whole bunch of explosion going your way. So those are the kind of thing. Now, if you've done everything right, you have a proper diet, you have good exercise, you are mindful, you have an amazing job, and life is peachy, and yet you still have all of that, then the only thing left to do is to reduce the amount of existing poison or inflammatory tissue inside your body, because you might accumulate that over the years. So even though right now your life is okay and nothing happened, but if you haven't gotten rid of the impurity, the inflammation, then you're not going to do well. Case in point we see right now is that you hear about, coronavirus and some of these, they call it, these chronic coronavirus patients. They clear from coronavirus, but they continue to not feeling well. They don't walk well, they run out of breath all the time. Those are the kind of patients that now they accumulate a lot of toxin in their body, inflammatory tissues in the body, and since they haven't cleansed it out, it doesn't help. They're still not feeling well. Young people usually can get away with not having to do anything, but as you get older, chances are you're going to actually have more of that problems. So what is the answer? Now I tell a lot of my patients how to detox the liver, detox their GI system. So the same thing. So for this person with the chronic aches and pain, fibromyalgia and all of that, then even if everything is perfect, you need to get really seriously in detoxing yourself. So then your body is going to be able to get rid of all of the toxin and the impurities and the hormone and the medication you took over the years, so that your body becomes more purified. Once your body becomes more purified, it's going to actually kick in this thing called growth hormone. And growth hormone is what you had once upon a time when you were a baby to grow your organs, you grow your bone, grow your tissue, and heal yourself. And so once you actually get to see the increase in the growth hormone, all of a sudden life becomes so much better.
How do you feel about the power of nature and hiking to deal with stress?
I always like to be in nature and hiking. In fact, many of you know me that right after work, I see a whole bunch of patients. I was like, where do I go? I go to the beach, I literally walk in the water, or I go hiking right after that for, hours or so, or 45 minutes. So I think it's actually wonderful. But just a tiny words of caution. Of course, if you got the fire and all the smoke and everything, you don't want to be out there. But at the same time, if you actually have excessive amount of weight on your body, then I caution that, because you might be hurting yourself. It's like me wearing a suit, an extra 60-pound, 100-pound suit, and tell me to go up walking the hill. Well, it's kind of hard. And then I might be motivated, my mind might be there, but my body will give out. And sooner or later, I'm going to hurt my knee, my joint, my hip. And then next thing you know, some doctor's going to do some procedures on me, and then I have to be a couch potato. So for those people, usually the best thing to do is have a proper diet first, lose some of the weight first, then do the exercise, heavier exercise. But the easy strolling and walking around the neighborhood, or even easy to go hill is totally reasonable. Now, while you're doing that, I highly recommend you to express a sense of appreciation. I think a lot of us, we go through life, we keep talking about me, me, me all the time. I want this, I want that, and all of that. I think it's important to express a sense of appreciation. Just speak it out, either in your mind, or when there's no one walk around you, you can speak it out loud. I do this all the time. Say, I am thankful. And then just say whatever you're thankful for. You can say, wow, I am thankful today because, I'm healthy. I'm thankful for amazing life. I'm thankful for ability to make differences in people's life. I'm thankful for a number of different things. And then, at the same time, I would like you to say, I am thankful for many more months or years of the same stuff. Because in that way, that not only you are thankful for the existing situation, you're also thankful that the many years to come. Now again, if you're religious and you believe in a certain high being, you would say, oh, and thank God, thank you God, I'm very thankful for many more years to come of amazing life, amazing experience, amazing wisdom, or whatever that you would like to be thankful for. Now, I want you to be true to yourself. So don't just fake it and say, well, I'm thankful for whatever, even though it's a terrible situation. Find the things in your life that you can be thankful for, and then you're thankful for more of the good stuff to come your way.
How does one deal with toxic family members, such as a mother or siblings? Cutting them off seems extreme, but communication is impossible on their side. So what should they do?
Well, remember, we talked about this before. Family members is one of those things, is that you especially, let's talk about just like the very first patient I mentioned. You stuck with her. You can divorce your spouse, you can disown your brother and sister, but it's impossible to get rid of your parents, regardless of how much you try. So might as well not trying. So let's find the best way to deal with that. You are already pre-programmed to love your parents, and your parents are pre-programmed to love you no matter what. So it doesn't matter what, you need to find a way. So I think the important thing is, it is a two-way street. You need to have a willing participant. First, for any issues and problem in life is, you need to become cognizant that it is a problem. Because if one side thinks that, hey, we don't have any problem, this is how we communicate, we're screaming at each other all the time, no big deal, well then, doesn't matter what you say or do, it's not going to help. So if, the mom and the child already realize, yeah, how come we keep cutting each other off, we're not being respectful, then find a moment when you're not in the heated debates and set some ground rules. It's that simple. Say, okay, so when we have conversation, can we do A, B, C, and D? And if things get too hard or too personal, I'm going to disengage and we can rediscuss with you 5-10 minutes later. It is not a sign of disrespect to walk away from that conversation. It's just actually the sign of strength, that you realize that when you go down that road, when there's revolving door, then you're going to actually not making things worse by having that conversation. The beauty is that instead of having one of these kind of rerun story in the family, when we all see that people start to get hype up about certain scenario and situation, and then things get worse and worse, and there are all these hurt feelings, we stop early. We quit while we are ahead. So if you 5-10 second into that conversation, or a few minutes into the conversation, well, guess what? Disengage. Take a break. I always tell my patient this about, parents. When you are younger, you have your kid, and if they don't behave, guess what you do? You actually give them a timeout, right? Well, that's the same reason why we do that, so that things won't escalate. Well, guess what? When you get older and your kids get older, instead of you give them a timeout, maybe you should give yourself a timeout and just say, honey, we'll talk about this later. And then walk away, come back when you are more well composed, so you won't be overly sensitive, and you won't be overly emotional. And I think all of that, that little break is going to go a long way.
How do we deal with a loved one whose beliefs are getting too extreme, that it might bring them harm to them, such as believing that COVID-19 is no big deal?
Oh, I guess they probably have that debate right now going on with the vice presidential debate, and you guys tuning into me. So guess what? You're not even watching the debate. And as you can see, our nation becomes so polarized that there is no room for love and affection. So someone say the word Trump, then all of a sudden, if you like that person, you become my enemy. And if you love that person, you can be someone else's friend. And I think that is so wrong. Just because you mention somebody's name or a certain kind of belief that they have, I think sometimes it's okay to let it be. Let people believe what they believe. Sometimes you can lead the horse to the water, but you cannot make the horse drink the water. So you do the best you can and let it be. One of these days, they're going to be brighten up, they're going to be enlightened, they're going to understand. Because I believe that truth will always come out. So right now, there's all sorts of allegations about fake news and fake this and fake that and who's right and who's wrong. Doesn't really matter. In my opinion, I don't think it matters that much, because truth will come out. Now you want to make it easy and safe and as right for you and your family as much as possible. But at the same time, there's only so much you can do. So if your family members go out there and being reckless and not wearing masks and not practicing social distance and, go to these weird, gathering, well, there's only so much you can tell them. But that's it. It's still a free country. They still get to make their own decisions. And if their decision isn't what you think is the best, it is what it is. Now, sure, there's other reasons that you wanted to make sure they do other things because you don't want them to go out and infect other people. But again, at the end of the day, if you've done the best and you try to enlighten someone about certain kind of facts and the right way to do things, and they don't, it's okay. You've done your best. That's all you can do. You don't have to worry about, oh man, I wish I would do it more. I'm going to do this and that more. Again, you've done your best already. So it is what it is. Let it be, and then see what happens. See, the funny thing is when you have those kind of conversation with yourself, you let fear overcome your emotion at that point. And the more fearful you are, the more emotional you get. And that's where the anxiety, depression comes in. So once you've done everything and you no longer fearful or depressed about it, then all of a sudden life, you not carry that burden on your shoulder all the time.
When I get stressed, I find myself very tense and catching myself clenching my jaw subconsciously. How do I handle headaches and body pain caused by stress?
Yeah, and that's a common thing. It's a very common. People get stressed out, they tense up. And again, always start with why. Why is this happening? Number one, when you tense up, then all of a sudden you accumulate more lactic acid. And you hear about this from like exercise expert all the time. You got to be stretching and you got to drink a lot of water and all that stuff. Why? You want to flush out all of these lactic acid that was produced in your body when you were exercising. So when you tense up, you trap in so much lactic exercise. We certainly have many patients that actually come in and have big old knots everywhere in the body and it hurts like crazy. And they went to physical therapy and they take all sorts of medication, but they're not getting better because that stress, the initial cause of the stress make them tense up. So what we do is I was find out what causes stress or why causes stress and then address that. Once you address that, then you're less likely to have those triggers again. So again, going back to the whole topic of today's discussion about anxiety, depression, is that you want to find out what is the trigger for your anxiety and your depression. Once you actually know what the trigger is, then all of a sudden you need to have a plan to deal with it. What do I do with my anxiety, depression in case I have that attack? And that could be some routine that I do, could be certain food that I eat, certain supplement that I do, medication I take, whatever it is, you need to have the plan all lined out. No difference than you have a plan when there's an earthquake, there's a fire, there's emergency. You need to have that plan. We all learn the other, all the other kind of routine when we're little. We should have this plan for ourselves when you have anxiety and depression kind of trigger that comes our way. So again, going back to the tenseness, really the things to do is, you want to have a good deep tissue massage. You want to drink a lot of water. Your tissue is more relaxed. Sometimes little muscle relaxation would be helpful. The thing that actually make you tense up is sympathetic system, right? So when you have a lot of sympathetic system firing, and it just keep firing because you're anxious and you practice all of these things, what is the thing that actually reverse it? Parasympathetic system. The good news is that in the state of California, marijuana product is absolutely legal. So you can get some of those kind of product. CBD, for example, oil would be extremely helpful to put onto the skin locally, and then do some sort of deeper tissue massage or cupping, for example. I think all of those are very helpful again to kicking in the parasympathetic system, so then your body is more relaxed. But none of that is going to be helpful unless you manage your trigger mechanism. So if you get a terrible pause and you show up to work every single morning and that starts the cycle of torture all over again, guess what? You need to change that. You need to write the boss up, you find another job, you complain to somebody, but you got to do something. Because if you don't, you are torturing yourself every single day. And no amount of massage, no amount of CBD oil, no massage, no amount of cupping, that's going to change all of that. So you need to fix the original problem, the cause of the problem. Once you fix the cause of the problem, then things become more manageable.
Cognitive therapy is shown to help with mood disorder because it helps you understand how your thoughts affect your mood. Do you or anyone listening recommend a good therapist trained in cognitive therapy that you would recommend so we can refer our colleagues who need help?
So as you can see, it just sounds complicated, isn't it? Cognitive therapy, what do? That's the problem. The problem is that we make all of these things so complicated. And I think this is a secret in life. You know, you go to school and you got these professors out there who actually go and draw all these arrows on the board. And then you look at it's like, man, the guy might win Nobel Prize, but I have no clue what he's talking about. Or I just understand maybe 5-10%. The secret is how to take complicated issue and distill it into a simple 1, 2, 3 steps. Because once you have 1, 2, 3 steps to follow, it becomes very easily, you can implement that easily. So I strongly feel that the best therapist is you yourself. And the reason why is that the more you understand about yourself, the more you become cognizant of your issues and problems, the sooner you actually can help yourself. We are gonna, have some cognitive therapists that we are gonna put on there. But what I'd like you to look at those folks is just the beginning. They might help you to become more cognizant of your issues and problems. But what I like you to do is to become the best therapist in the world so that you can help yourself. The beauty is that we are different. We all have different issues and problems. That therapist will not know all of the issues and problems about you and your life. Sometimes there's issues you don't feel comfortable to share with him or her. But guess what? You're going to feel comfortable with yourself. So start with that simple mirror exercise and writing exercise. And the more you are connected with your body and yourself and your soul, the more effective you're going to be in taking control of your life and better yourself.
How does one deal with toxic coworkers?
Stay away from him or her. That's it. Sometimes, and I think the important thing is when you see toxic coworker, don't look at them and say, oh my God, I have to deal with this again. In many ways, you should feel sorry for that person. It's not a reflection of you or what you do wrong. It's a reflection of him or her or what that person does wrong. Maybe they go through a divorce, maybe family issue, maybe stress, or maybe fibromyalgia, maybe anxiety, maybe depression. There's so many reasons why people have this kind of issue. So instead of, look at them from a negative standpoint, just give them the benefit of the doubt, saying, yeah, I'm really sorry that happened. But at the same time, you don't want to drink the poison either. So therefore, don't start to suck it in and say, oh my God, I feel terrible because so-and-so say certain bad things to me. Or just because someone say bad things to you or intimidate you, don't let that enter your body. So just walk away. So let it go, walk away. Walking away is always the best option, especially at the workplace, because of the fact that no one can corner you, no one can bully you and that kind of thing. The person that bully you only enjoy doing that when he or she can really corner you and kind of make you react a certain way. But if you don't react a certain way, then nothing happened. And they will move on because you're just not exciting to bully anymore. And that's why. So that's important. But even while you interact with such of these, toxic people or bullying people and those kind of things, in the back of your mind, do me a big favor. Just remember, the reason why they bully, the reason why they're toxic is because they were treated that way. They were bullied once upon a time. They were treated by toxic family members or friends or acquaintances once upon a time. That's why they are who they are. So have some mercy on them and not hold the grudges against them. At the same time, keep yourself safe, keep yourself sane, so that way you won't be taking it home with you because your family member won't appreciate that at all.
How can we help or deal with our children who are dealing with the anxiety and stress of homeschooling and distance learning and the COVID pandemic? Most of our kids have stress and anxiety from this new virtual learning system.
I agree. That's one of the reasons why we have this conversation today. I think it's extremely stressful. And you talk about the children get stressed, you talk about the parent get stressed. Just imagine you have a job, and many of you probably doing that. You have a job, you have to do your job, then you have to be the teacher, then you have to be the caregiver, and you have to be the organizer, you have to be so many things. And it is extremely stressful for everybody. So the things to do, just like anything else is in life, when you're faced with this mountain of tasks to do, don't be a Wonder Woman or Superman, try to do everything yourself. You set yourself up for failure. So divide it up. Put down the tasks, and then everybody have their parts and do them. That's basically how they do it in the military, isn't it? Just because they do all of these, big operations in military, well, the general can't do everything for you. The general is going to tell, the colonel, and then tell the lieutenant, and tell the platoon leader, and all that stuff, and so on. So you can basically mimic similar kind of operations management. Just a fancy word from business world that, you divvy up the tasks and everyone know their part. And it could be something simple. Get a big whiteboard out and say, okay, who's supposed to wash the dishes? Who's supposed to clean the toilet? Who's supposed to take out the trash? Who's supposed to do whatever? And then hold every person accountable for that. Now, while you're in the midst of that, sometimes you think, oh my God, my life is so miserable and the kids' life are miserable. But let's look at slightly differently. Maybe this is actually an exciting time for them to learn how to be responsible. So many years now, a lot of children growing up, they just kind of getting dropped off to work or to school or on the bus or something like that. Life is easy for them. They don't know what it's like to have a difficult life. Now they know what it's like to have a difficult life. They need to do a lot of these things yourself. They need to set up the classroom things for themselves. They get difficult with their homework problem. They need to solve it themselves or get some help, whether with parents or with teachers at school or tutor or whatever. The point is, they need to learn how to do these things. And it might seem overwhelming for them, but that's how all of us human beings learn, is that we learn by trial and error. The more you try, the more you make mistake. The more mistake you have, the more likely you are successful. You look at all the successful people in the world, I can bet you with 100% certainty, they're all going to say the same thing. I made so many mistakes before I get this and that wrong. So people get lucky, not because they are lucky. You got lucky because you try so many times. So your chances improves. So guess what? When you're in difficult time in your family, let's just divvy up the tasks. And then that way everybody knows their part. Now initially, it's going to be ugly. Nothing is going to come together. Everything seems to fall apart. But let it be. Don't try to jump in and be a Superman or Wonder Woman and fix everything. Let it simmer down, and then it's going to be beautiful because the children, the spouses, other people is going to be able to step up to the plate and then take on the responsibility, and over time they get better. And while they're doing that, they're going to learn an important life skill to better themselves, to get organized, and it's going to be beautiful for them. I got 3 more questions. I will answer them quickly, I guess.
What is the difference between CBD oil and actual cannabis? Because I have a huge fear of drugs, especially for my children.
So as you can see, fear takes you over. So do a little research on this. And my big thing is that doesn't matter what they say on the internet or even on medical journal and everything, there is no answer as you find out for yourself. Because people might tell you, oh, CBD is okay, it's not like marijuana, it's not, you're not going to get stoned with it or anything like that. Well, how do you know that for sure? What if you have that effects? So my suggestion for many things that you might want to try out is that just get a little tiny amount, try it out, see how it goes. And if it feels fine, it calms your nerve down, no problem, then you can use a little bit more and then go from there. So if you worry that the CBD oil you put in your skin somehow, instead of reducing your tenseness, that all of a sudden you have a more, you get stoned, well, use a little bit small amount and then see how it goes, then a little bit more and see how it goes. Chances are CBD oil will not give you those kind of effects to bring your mood down like that.
For all the essential workers who do a lot of physical labor, or also a lot of the people who work at home or work in an office all day at a desk, what are some effective stretches that we can do to fix our tense shoulders and back pain?
Yeah, so 3 simple steps. A lot of times you run around, you're doing stuff like, well, you got no time. Well, I run around doing stuff all the time too, and sometimes you might find me run up and down the stair at Salinas Valley hallway, or the stairway. Find a simple place. You don't need anything fancy. The beauty is that you don't need to go to the gym and pay gym memberships or anything like that. So my favorite is find some kind of exercise and do 3 to 5 minutes of that, and repeat the whole cycle 3 times a day. That's it. So now all of a sudden you get about 15 minutes of, solid exercise. So my favorite is, if you're like in a more contained environment and you can't do anything, my favorite is 1 minute of push-up. Do the best push-up that you can do. Even if you can do only 1 push-up for a minute, that's fine. But over time you can do 1 and 2 and 3 and 4 and then more. And then second one is I can do a minute of sit-up, for example. 1 minute of planking, for example. And then you can do, that little ab roller stuff. I think you do a minute of ab roller and a minute of like pull-up, any kind of pull-up. So by the time you do 1 minute of those, those calisthenic kind of moves, exercise, then you repeat again another time. And then that's it. And then you get your circulation going, you get your heart pumping, and you'll be nice and relaxed. If you really want to reduce all the aches and pain, it's going to be a topic discussion for the future talk. It's called cold therapy. In fact, I actually put on the Facebook thing way at the beginning when I talk about it, and I was going to do that, but I didn't think a lot of you were ready for that. I think cold therapy is going to help you tremendously about relaxing all those muscles, because it's going to help to kickstart your lymphatic drainage system. So maybe one of these days we'll do that.
Okay, last question. When I get stressed, I have a hard time taking care of myself. How do I find that motivation? All
right. So when you get stressed, you don't want to do anything. You just want to sit there and you get moping and other stuff. I think the best thing to do is nothing. I know it sounds kind of strange. Like here, you didn't want to do anything. You ask me the question and I tell you to do nothing. Because doing stuff is counterproductive. You need to have a game plan. Remember we talked about the game plan? So whatever that trigger you to have a problem, whether anxiety, depression, stress, you need to find out what triggers that first. Once you know what triggers that, then you have a plan in place, so then when it does happen, you're good to go. So for example, someone said, oh my God, when I go to big meetings and stuff like that, I get super stressed out. Okay, well, great. So when you go to big meeting, you know exactly where to sit, where to eat, where to put your material down, and when to leave. Once you know all of that, then chances are you're going to do really well. You're not going to get into a situation you don't know what to do. So I think it's really important to have a game plan in place. When you have a game plan in place, then it becomes automatic. The more routine that you do, the better it is. So for your specific situation, if you have certain kind of stressful situation that you got yourself into, what do I do? It could be a simple, well, I'm going to take a nice warm shower. I'm going to get, massage. I'm going to take a walk, on the hill. whatever the routine is, you want to stick with that. The beauty is that once you have that routine in place, the amount of stress level of you started out here is going to go all the way down, because you no longer, you have that sense of comfort knowing that, yeah, I got it. I have a way to deal with that. So even though it might be raining outside and your deal is to walk up the hill, guess what? You drive to the hill, walk up the hill anyway with your umbrella, because then again you have that sense of comfort. I would like to thank you so much to come today. This is the first time I do this Facebook Live. It's kind of exciting. There's really no difference in me talking to you in the exam room, and a lot of you know me that this is what I do, right? I go to the room, I just have this heart-to-heart connection and just kind of talk to you. And the cool thing is that it does happen even through this internet meme, and I see all these little heart flying up, and that's really the cutest thing. And I think that's is how we build a community, to have the heart-to-heart connection, so then that way we can help each other to better ourselves. And even if you come across that meanest person or the meanest toxic person or the bully at work or wherever, have some passion for them, because maybe they were the victim, and most likely they are. And then together we can build a positive attitude, and really the environment of love and support, which we don't see a lot in this day and age. And I think it's really sad, and I can't wait for things to become a little bit better. So again, I really appreciate your time and attention, and we're going to do more of these stuff. So if you have any ideas, let me know. We have this closed Facebook forum that if you want to get in there, I put all these things once in a while. So just put questions in there. Feel free to put the question. If I don't get to it, we'll get to it eventually, so that we can all do these things together. Until next time, I guess. That's it. I'd like to thank everybody, including my producer. I got two producers. One is Diane Hahn. She's not even here. She's in San Jose. And my co-producer, Grace Khieu. Both of them do an amazing job. I just show up and talk to this camera, the cell phone, really. And I think it's the coolest thing. And we'll do more of this. Yeah, thank you.